My name is Susan Khalil. I'm an assistant professor at the Icahn School of Medicine and in the division of minimally invasive gynecologic surgery at Mount Sinai Hospital in Mount Sinai West. That's with Mount Sinai Health System. I specialize in endometriosis, and thank you so much for your time today. So endometriosis is a condition in which there's ectopic implantation of the endometrium, which is just basically the lining of the uterus. So meaning the lining of the uterus is implanted in sites outside of the uterus. And that can be the tubes, that can be the ovaries, it can be inside the belly, it can be in the lungs, it can be in the brain, it can be in very distant sites. And it's usually during the reproductive age group. So meaning while women are during this period, they'll have these symptoms that are suggestive of endometriosis, and they can present with many different kinds of complaints that can point towards endometriosis. So I'm really happy that we're talking about this since March is Endometriosis Awareness Month, because aside from having a patient-facing portal and really trying to educate patients so that they feel empowered to getting a better diagnosis or getting a diagnosis or living better lives. But also it's important to highlight the awareness of this condition for early intervention, early diagnosis, and less invasive methods of managing the condition. So some of the symptoms of endometriosis, and the ones that are most common, are painful periods, pelvic pain that's sometimes unexplained, painful urination, painful bowel habits, painful intercourse. It can also present sometimes when women are trying to get pregnant and they have trouble getting pregnant. So those are the two common ways that patients come in to get evaluated for endometriosis, and that's usually what they describe. So it's largely unknown, but there are a few different theories. Some theories include retrograde menstruation, meaning that the period will flow backwards into the belly instead of flowing downwards. The other theory is just de novo formation, meaning that it just happens on its own. And then finally, just local cell changes that can lead to endometriosis. So there's a wide spectrum of that, where you can have women who have gotten pregnant and we incidentally find out that they have endometriosis. And there's some women who actively pursue treatment or diagnosis so that they can have fertility-sparing surgery and fertility-sparing methods to try to get pregnant. But yes, they can get pregnant. Sometimes they just require some assistance with that. So largely the treatment options include medications or surgical options, but we also offer a team-based approach to the Mount Sinai Health System that includes various specialty surgical services as well as non-surgical options. That includes pelvic floor therapy, acupuncture, dietary management, pain management, all things that can make it just more of a livable condition with a good framework for support. So some of the surgical options for endometriosis include excision surgery. They also include fertility-sparing surgery, which involves laparoscopy. Laparoscopy can be used as an early diagnostic method. It can also be used for intervention by excising the endometriosis or cutting it out. It can also be a good method with minimally invasive gynecologic surgical methods to try to remove the endometriosis, perform fertility-sparing procedures, and procedures to help reduce the pain and improve quality of life. Additional things that we use for sometimes robotic surgery, where we're able to see the endometriosis sometimes in various areas in a better way, and provide great surgical options for patients that are less invasive. Just some final thoughts, or I just would love more awareness. So I'm really, really happy that since March is Endometriosis Awareness Month, that we're able to highlight this condition and really bring more awareness from all sides, from medical system, from patients, a patient population and perspective, as well as just other groups that are within healthcare, so that we can really optimize care delivery for endometriosis and early diagnosis and management for great patient outcomes.